am happy to introduce Patrick Hiemel, who is a physician and the Chief Executive Officer and co-founder of Medsnap. He has focused on patient safety issues throughout his career as a physician and entrepreneur. His aim is to ensure technology improves patient outcomes without disrupting the clinician-patient relationship. Prior to founding Medsnap, Dr. Hiemel co-founded MedMinded, Inc., where he led the effort to expand statewide hospital-acquired infection prevention initiatives across the country. MedMinded was acquired by Cardinal Health in 2006, and Dr. Hiemel remained as Vice President and General Manager until 2009. He earned his Doctor of Medicine and completed an emergency medicine residency at Louisiana State University School of Medicine in New Orleans. We won't hold that against you. Welcome, Dr. Hiemel. Thank you.
Thank you. Thank you. And I just appreciate everyone's hospitality for welcoming an LSU Tiger fan in here, and I hope you don't hold that against us back. Most of the presentations that you guys probably attend, people talk a lot about teaching you something, or trying to teach the senior choice group here at Coleman Regional something about an issue. Well, today you guys are really teaching us, and we really appreciate it, because this is the first event of its kind that's been done using this type of technology. So about 18 months ago, I met with Mr. Widener, the CEO and president of Coleman Regional Medical Center, and we talked about a research project that we were doing to keep patients safe with their medications. And he was incredibly supportive, and he and his staff really welcomed us in and allowed us to beta test and to really refine our technology over the last year and a half or so here at Coleman Regional. And so today is really the culmination of that, in that we're able to help the community manage their medications, get a new medication list, ask questions, speak to the pharmacists that we have that are helping out today, and really be safer. And that's really what the goal is. Because I'll tell you, I've written a lot of prescriptions for patients over the years, but I never really understood how hard it can be to manage those pills. I mean, this is something that we see here today, where there's lots and lots of medications that people have to take, and it can be very difficult to manage. And so the aim of our technology is to make sure that the clinicians that you see in the clinic or in the emergency department or at the hospital can rapidly identify the medications that you take and take better care of you. And that's our goal. So I have a few questions for you guys. So like I said, this is more about kind of learning from the community how we can make you safer. How many people have ever found a medication in your bottle that didn't match the label? Has that ever happened to anybody, where you get a set of pills and it's not the right pill in the bottle? Has that happened?
Yeah, right here.
Right here? That happened to you?
Walgreens gave me a whole wrong medicine. When I got out, I was out of it. I went to the car and I went to take my medicine. And I looked and it's all together different. I got to looking, it had the wrong name on it. So I carried it back in there and the other guy done picked up my medicine.
So there are all sorts of opportunities for these types of mistakes to happen, and we want to make sure that people are safe, which is the reason that we took a picture of your medications to identify them. Now, has anyone ever had a medication change from month to month? When you go to pick up the prescription and you get the bottle of pills and it was blue one month and it was yellow the next month. Raise your hand if that happens to you. Okay. Because medications nowadays are generic. Lots of the medications that your insurance company or Medicare pays for are generic, and so they can change month to month. So another reason that we like to take pictures of pills is so that we can keep which medicine treats which disease straight for you and give you a list with a picture on it. Because every one of the pills that you see on the screen is an entirely different medication. So there are lots of pills that look similar to one another, and there are actually lots of different pills that also different. There are lots of different medications that look similar, and there are lots of similar medications that look different. So this is why we developed computer technology, to be able to tell them apart. So the reason that we're all here today is to improve what we call the medication history. A medication history is every time you present for care, whether you're going to your doctor's office or whether you're in the emergency department, they're going to ask you, what medications do you take? And if you don't have a list and you're on more than 5, it can be very difficult to remember what medications that you're on. So one of the things that was our goal for today was to make sure everybody leaves with a good, up-to-date list so that you can present that list when you show up for care in the clinic or at your doctor's office visit. Because it turns out that little question that we all kind of almost become so used to that we don't even pay attention to it, what medications are you on, is one of the most important things related to the outcome of your care, of your health care. So getting that question right, what medications do you take, is incredibly important if you have to be seen in the hospital or if you're in the clinic. Because it turns out that medications can not only cure disease and keep our chronic conditions under control, but they can actually hurt us if they're working against one another or if they interact with any of the conditions that we might have. So the reason that you guys are getting consulted with the pharmacist here today is to make sure that all of your medications are working for you and none of them are working against you. So it turns out, as I said, that medication histories are a big problem. About 25% of admissions to the hospital will have some type of error. And this is because the assignment as a physician that we give, that physicians give to their patients, is a really hard homework assignment, keeping up with all the pills and all the medications. So when you come back into care, it's very easy to confuse that information and potentially make a mistake. So as we kind of focus on keeping health care accessible for everyone and keeping people safe and keeping the cost of health care, which as we know is growing down, looking to make sure that everyone has a good medication list and that the clinicians that see you in the clinic or in the emergency department can take an accurate history is really important. So as I said, the gentleman in the back of the room recalled a story about getting the wrong pills in the bottle. This actually happens more often than you might expect. Nationally, studies have been done and show that between 2 to 3% of the bottles that you get from a community pharmacy could have some type of error in them. And that error can originate at the pharmacy, it can originate with your doctor or nurses who are taking care of you, or there are other factors that can be involved. So this is not an uncommon problem, and one of the reasons that we developed this technology was to be able to prevent that type of outcome. So what's the solution? Well, have an up-to-date medication list. It's really important, and that's one of the goals that we have today. Make sure that what you take every day is indicated in the information that you pass along to the nurses and the doctors and the pharmacists that take care of you. That is really important. And never forget that when you sit down in a clinic and someone asks you, what do you take, or what do you take every day, that is an incredibly important question that we need to make sure we answer fully and completely. And the reason that we developed Medsnap as a technology actually originated with a personal experience that I had, where my grandfather, who was being treated for cancer, had to take 14 medications or 12 medications, I forget exactly the number, every day. And one of his medications was really important for his cancer care. Unfortunately, the instructions that came with the medication, he didn't completely understand. And he was supposed to take the medication 4 at one time in the morning, but he misunderstood and was taking them 4 times a day. And that went on for a number of weeks. And I'm a physician, my brother's a physician, my sister's a physician, my aunt's a critical care nurse, and none of us caught it. So after that experience, I figured that the only way I could have known how he was incorrectly taking the medication would be to watch him put his pills together. And that's what we're doing for each of you guys today. We want your help at saying, these are the pills that I actually take every day. And often, I don't know if you guys noticed at the tables, sometimes what you put down every day and what's on your list are not the same thing. And that is important for us to be able to recognize and capture in order to keep you safe. So fortunately, that episode with my grandfather, it didn't, we caught it after a couple of weeks, and he did well after that. But it really, that's when it dawned on me that we needed a better way to take a medication history. So that was about 2.5 years ago, and we started working on Medsnap immediately thereafter. And it's taken us about 2 years to get to this point where we can recognize pills with the computer, like we did for you. And it's really, really hard. Now, do these pills look alike to you guys? Well, they should, because they're actually made out of the same capsule. So if the color blue that you see all the way on the left, all the way on the right, I'm sorry, right here, this is actually the exact same capsule that the manufacturer has used to put this medication in. Now the writing on the capsule is different. You can see the one on the top has a little hourglass-like shape, and the one on the bottom just has a writing. But if you look at this from a distance, it could be very easy to confuse these two medications. However, this is a generic form of Prozac, and this is a generic form of medication that they use to treat attention deficit disorder. Entirely different medications that look very, very similar to one another. And the distressing thing about this, when I learned about this type of event, was that it's possible for these pills to end up in a household's pills. So you could think of that one family member might be taking this medication and another family member might be taking this medication. And so these are very dangerous types of look-alike medications because they can be so easily confused. So one of the services that Medsnap offers to hospitals is that we go through the pharmacy's stock of pills and we look for problems like this to make sure that the pharmacy here at Coleman Regional does not stock medications that could be easily confused. And that was one of the first services that we performed for the hospital to make sure that pills aren't easily confused with one another. And this is not even the worst. These are two medications that we were at a hospital in Texas and we were doing the same safety screen for their formulary. So all the pills that a hospital keeps on hand are called their formulary, their pill formulary. So we do safety screens of pill formularies to make sure that the pills are safe and that nobody gets confused with the medications. So this medication is actually used to treat, it's an atypical antipsychotic medication for patients who have issues that require that kind of medication. And then meloxicam is for your tennis elbow. Or your knee pain or your arthritis. It's what they call an NSAID, a non-steroidal anti-inflammatory. Can anyone tell these two pills apart? It's very, very difficult. So by law, the FDA mandate that each pill be different by color, shape, size, or imprint, but they don't have to be different on any two. They only have to be different by one. So you'll notice that this pill has the same imprint in about the same font or same type style, and it's yellow. It has an imprint on one side and has no imprint on the other. The only difference between these two pills is that one is 8 millimeters in diameter and one is 7. So you're talking about a difference of less than 1/4 of an inch or so. You know, very small difference, about 1 millimeter or so. By eye, it would be very, very difficult for a trained pharmacist to tell these two medications apart. But our computer technology, the Medsnap computer technology, can easily differentiate this. So to put that in perspective, these pills differ by 1 millimeter. The Medsnap technology that analyzed all of your pills this morning, it measured your pills to within 1/10 of a millimeter. And one of our future goals for using this technology, and the reason we're so grateful for you helping us today and allowing us to snap your medications, is that we would like to be able to identify counterfeit medications, which if you've been watching the news is an increasing problem. Because medications nowadays, they come from all over the world. They're manufactured in various countries and they're shipped long distances before they make it to you. So having a system that could identify, not just differentiate this pill from that pill, but know, is this the appearance of the pill that we would expect, to make it harder for people to produce medications that are not real. So it gets better or worse depending on your perspective. And like my family tells me, boy, Pat, you know a lot about pills. And I kind of, our whole team, we obsess about them because they have some unique and dangerous characteristics. So there are a whole series of pills that have what we call a score on them. So the score is to help you if you have to divide the pill in half. But then they put very similar shapes, and it's hard to even tell here. But this is Lexapro. Anybody take Lexapro? A few people? Anybody take Synthroid? Yeah. Anybody think that you might be able to take Lexapro and Synthroid together? Some people do, right? So these medications have a score and 2 letters, and they look very similar to one another. Same thing with Lasix and Tenormin. How many people take Lasix? Lots of folks. And Tenormin? It's a beta blocker, yeah, hands over there. So these two medications can look very similar to one another, and they actually manufacture them with the same 2 letters as the imprint, RE, and then a number. And that can make it very difficult to tell them apart. And remember, it's not just telling them apart for your own pills. It's if it's a husband and a wife, you have to tell everybody's pills apart. And we've been on home health visits where we see the husband's medicines, the wife's medicines, the dog's medicines, all together. And it can be very easy to confuse these. So one of the reasons we developed this technology is so that when nurses come to the home or when they're assessing patients in their home with home care, that they can quickly go through your pills and make sure that they're safe. And this is a medication that really kind of worries me. This is glucotrol. So this is an oral medication to keep your diabetes, to keep your sugar low. And then this is Toprol, which is a beta blocker to keep your blood pressure low. The one thing about medicine that I'll teach you guys today maybe is that you don't want someone on a beta blocker getting this oral hypoglycemic, and you don't want an oral hypoglycemic being confused for a beta blocker. This would be a very dangerous substitution to make. Yet these medications, can anybody tell them apart from what I'm showing you here? It'd be difficult, okay? So this is why we invented this technology, to be able to precisely identify differences like this to make sure that the people who are taking care of you know what you're taking. Does anybody have any questions about what happened today, like with the snaps, or there was the flash or the camera was going off and people were reviewing stuff on the smartphone? Does anybody have questions about it? So how many colors can we differentiate? That's a great question. Thank you for asking that. The camera flashes the flash, and it's put on a special surface so that we can tell the difference between 250,000 different shades of color to be able to precisely identify the pill that you have. So is there anybody who thinks they might have the largest number of pills here today? I think there might have been a prize or something for that. I thought we had some people who were on so many vitamins. I've never seen somebody so healthy with so many pills. They're on so many different vitamins. So the different areas, so this technology, this is the first day of the first use, and Coleman Regional is the first hospital in the nation to have this. So you guys have really been part of something very special, and you should be proud that you interact with a healthcare facility that's so progressive. But there are other areas that we're going to be rolling this out to over the next couple of months. Obviously, you've met the pharmacist here today, and they've been very helpful to come and consult with each of you. It's going to be used in the pharmacy, like I said, to make sure that the drugs appear as they should be. We're already working in home health. So for those of you who might be cared for by Jennifer and her staff's home health service, they're going to be using it there to make sure that the medications that you have are what your doctors prescribed. And we're going to be using it in different areas of the Coleman Regional area. So that's my presentation. Does anybody have any other questions about anything that went on today? I know that it might have gone a little slower than we might have wanted to, but earlier in the week we were told there'd be 45 of you guys, and I think we have over 60 people. So we're very, very happy that you came, and very appreciative that you guys have been patient with us as we've worked through those things. So thank you very much. I appreciate your time. Thank you for helping and contributing to this effort. And hopefully we'll be able to do this again in the next couple of months and maybe check back in on you with your medications. So thank you very much. Doctors, when we go to medical school, we spend about 3 or maybe 4 months studying medicines, pharmacology as they call it. So we study pharmacy for about 4 months. The individuals in the white coats who are actually actively working with patients over here, the pharmacists, the clinical pharmacists, they spend 4 years. In some cases, they spend 5 years studying medications. So if you ever have a question about your medication, please reach out to your pharmacist. They're there, they're in your pharmacy, they're talking to you. They are incredibly knowledgeable about medications, more so than your doctor, okay? Now, and they'll communicate with your doctor about what the doctor is treating, which is the doctor's area of expertise, right? But in terms of like which medication to take which and is it okay, that's a pharmacist's area of expertise. And more today, as people are worried about, keeping people healthy in the outpatient community and, not having to be admitted to the hospital as much, pharmacists, I think, are going to be a tremendous resource for doing that. So I would direct you to ask that question, and we'll have one of the pharmacy staff come over and talk to you about that. But no, your pharmacist is an excellent resource. They do a lot more than just dispense the pills in the bottle. They can dispense some very valuable and life-saving information.
Thanks for joining us for today's edition of Health First. If you have questions about this episode or any of our other episodes, feel free to contact us at crmchospital.com or call us at 256-737-2600.